Today we look at two issues that are always high on the list of national concerns: immigration and border security, and healthcare, particularly the future of the now decade-old Affordable Care Act. In 2016, illegal immigration was one of the top election issues, made so particularly by candidate Donald Trump and his emphasis on building a border wall. In this election cycle, border issues have taken a backseat to other hot topics like the pandemic, the economy, and healthcare. But a lot of issues are still highly contentious. Today, we delve into some of those concerns with two guests: Ira Mehlman, Media Director at the Federation for America Immigration Reform, or FAIR, and Dulce Garcia, Executive Director of Border Angels, a San Diego-based nonprofit that focuses on immigration rights, immigration reform, and the prevention of immigrant deaths along the border. Ira, Dulce, welcome. Thank you for joining us.
Thank you.
Thank you for having us.
So I want to start by asking each of you what you see as currently the biggest issue related to the southern border and immigration that needs to be addressed. So Ira, why don't you take that first?
Well, what we need to do along the southern border, we need to do entirely is get our immigration system in a place where we admit people on a legal basis based on an objective assessment of their likelihood to contribute here, and most importantly, to discourage people from trying to come to the United States illegally. Preventing people from coming to the United States by convincing them that it's not going to be in their benefit to come to the United States illegally is the best way to deal with this. Nobody wants to see people coming across international borders, traipsing across hostile wilderness, taking the children on these long, dangerous treks. What we need to do is have an orderly process that admits people based on some kind of rule of law and discourage people from trying to come to the United States illegally. That is in the best interest of the country, and it's in the best interest of the safety of people trying to come to the United States. Okay,
and Dulce, what's your answer to that?
I agree with Ira that people should be allowed to come in lawfully. But one of the biggest challenges right now is that the border is essentially closed by this administration. It essentially shut down the asylum program, and people are by the thousands having to wait in Tijuana, which is sad. It's a sad chapter in an American history because we have families, we have children that are waiting for their opportunity to present their case in court, and we have denied them that, and they've been in Tijuana for months and in some cases over a year. So what Ira is talking about does not acknowledge the reasons why people are fleeing from their home countries. It doesn't acknowledge our involvement and our meddling across the world and the reasons why people are migrating, not just to our southern border, but all over the world. And Ira is absolutely right. We do need to change the system where we're investing so much in our militarization of our border that it's causing so much death. And so that has to also be addressed. We have to do something so that people no longer are forced to go through the deserts or the oceans or our rivers and lose their life.
Okay, so let me ask you both. I'll just start with a follow-up with you, Dulce. How, of the number of people that are trying to cross the border, what percentage of those are likely asylees? I just want to get a sense of how much of the issue that covers.
Yes, when we talk about over 1 million people migrating to the U.S. and migration happens back and forth, when we talk about 56,000 asylum seekers that were denied their due process and had to stay in the Mexican side, we're talking about a small amount of people when you're looking the grand scale of things. But these are 56,000 lives that were affected by this policy, the new policy by this administration, the MPP program specifically, that denies these folks the right to asylum and goes contrary to both international and our own national laws. You know, we were setting an example for the rest of the world with our asylum-seeking policies and welcoming refugees, and we undid all of that. And instead of making our process better, we put more people in danger. So when we talk about, in the grand scheme of things, millions of people migrating, 56,000 is just a small amount of people that we're talking about.
Well, if we want to protect the integrity of our asylum system, we have to stop the abuse of the political asylum system. Most of the people who are coming are economic migrants, and we certainly understand the reasons why people migrate for economic reasons, but that is not the definition of being a political asylee. You need to demonstrate that you are being politically persecuted at the hands of your government. And what you have now is a situation where people understand, or at least up until fairly recently, that if you got your 2 feet on U.S. soil and said, I want the political asylum, that we'd have to put you through a long process. You'd be released. Maybe you show up for your hearing. Maybe you don't. And it led to this wholesale abuse because only a small percentage of the people who were coming actually qualified. And then in addition to that, we have policies in place that essentially encourage people to use their children as human shields. And so you've seen the situation where you have kids whose lives had been put in danger because of these policies. So we need to have a policy in place that says, we are going to systematically exclude people who are coming here to abuse our political asylum system so that we can truly focus on protecting people who have legitimate claims and are in legitimate danger at the hands of their governments. And that includes, making sure that people check in with us before they come to the United States. It includes asking people who have passed through several safe countries on their way to our border to seek asylum there. Asylum is not to find the most ideal place to land. It is simply to protect you from alleged abuse at the hands of your government.
These people are looking for safety. And if your argument is they have to go through a process in order for them to be safe, that it's going to actually put them in more harm's way at the hands of this government as well. We put people amongst the most vulnerable among us in detention centers. And right now with COVID-19 in these detention centers, we're literally killing people inside the detention centers by telling them that they have to be forced to spend time in there. We're talking about families. We're talking about children.
Dulce,
so if your argument is they have to go through a process in order for them to get to safety, then this is more about what is right and what should be done morally, and not just about, follow the law and do this, fill this form in black and white. This is at the core of what
let me jump in here.
Humanitarian heart.
Let me jump in here because it seems the discussion is around the 56,000 asylum seekers, which are actually a small part of the bigger issue. So Dulce, do you see a system whereby we can achieve both goals, discourage people abusing the system and also make it easier for genuine asylees to make it to a safe land?
Absolutely. And it has to start again with the government recognizing its meddling across the borders. We have to acknowledge that people are being displaced because of the environment and our impact that we're having.
But what about the policy? How would you, let's take that aside. Let's say these people are already asylees and there's a lot of people crossing illegally as economic migrants, as Ira pointed out. What kind of policy could accommodate both goals? Do you see?
One that does not dismantle the asylum process the way that this administration did with the MPP program. It is not correct to say that Mexico is a safe place for these folks. Some are actually fleeing from Mexico as well. And so it would be to undo everything that this administration has done to let these folks in. They do go through an extreme vetting process. They are not let in just because they present themselves at the port of entry. They were already going through an extreme vetting process, and we were already putting them in detention centers. So I would undo the cruelty that is being done against these children and separating them from their families, because it's the U.S. government that's putting thousands of children in harm's way. Right now we have over 540-something children that still haven't seen their parents after months, because this government decided to traumatize them in that way. So it's this government that is hurting these families and these children. And that's what we would have to undo. Go back and improve the system that was in place, not dismantle the entire asylum process.
Okay, Ira, I think you want to jump in there.
Let's start with the 545 because they've been in the news lately. In fact, most of them had parents who returned back to their home countries and left their kids here. And that's why they haven't been reunited. The second thing is many of them them came with people who actually were not their parents. And that's one of the reasons we do separate the adults and children, is because we cannot determine immediately whether these are actual families or we're dealing with smugglers, in some cases even human traffickers. So it very much is in the interest of the children to be protected in these situations. Now, it's not just even the few thousand. We have more than, or something on the order of about 1 million people backed up in our asylum system. And that is an indication that the system is being massively abused. It was never intended for this. It was intended to protect people who were in the United States and for some unforeseen reason couldn't return safely to their home country. It confuses the refugee process with the asylum process. Refugees are outside the United States. They go through the vetting process and determine whether they have a legitimate claim or not. But simply showing up here en masse and saying, now you can't send me back, is simply an invitation to abuse the system. And we need to put a halt to that, because we do want to protect people who truly are in danger. But we can't do that if we're going to allow the system to be abused in the way it's been abused.
Okay, I'd like to move on to another topic, because probably we could go on this one for a long time. But I want to move to DACA, which is also in the news a lot lately. And I want to get both of your opinions on what to do about the DACA situation. Because of course, these people who came over who were children at the time are now adults, many of them contributing members to the country. I happen to know one who's a medical researcher. Their situation is probably the most complicated, I would say, in this whole situation. So what do you think can and should be done there in the present and going forward? So Dulce, maybe take that first.
Yeah, well, I'm a DACA recipient, so I'm a lawyer, and I know Ira would want to see me put in a detention center and deported, actually disbarred first. So this is something that is very close to me. I wholeheartedly believe we need a path to citizenship, and that has to come without any other bargaining for us, without any more border enforcement, without putting our families in jeopardy. And so that's what we need to get done, is to pass a bill that allows us to stay here without the uncertainty that we're going through with this administration by dismantling the DACA program. We also sued the president, and one of the plaintiffs that sued and took this case all the way to the Supreme Court, and we won. And in that process, we saw that there were hundreds of businesses filing briefs in support of the program. The overwhelming majority of Americans want to see us stay here, including the far right conservative folks still want to see dreamers here in the U.S. So that's a great question. What do you want to do with people like me that have contributed with our labor, contributed with our culture, that have contributed in many ways, for example, volunteering? I've done so many Know Your Rights sessions, and as a lawyer, I've done so much volunteer work. So what do you want to do with folks like us that are actually improving not only in the economy, but in the nation? I think the answer is provide a path to citizenship without hurting our families.
Can I just quickly ask you, how old were you when you came over?
I was 4.
Interesting.
This is all I know.
Ira, and what's your response?
Well, Dulce, your situation is not created by the American people or the American government. It was your parents who put you in this situation. They made a conscious decision to bring you here illegally.
And I thank them, and I'm so grateful for it.
Just like any other parent. Your parents are responsible for the consequences of their actions on their children. And we cannot ask the American people to constantly correct the problems that people like your parents created. They understood that they understood they were breaking the law. They understood that they were putting you in a difficult situation, maybe for good reasons. Obviously, they wanted to do better for themselves and for you. But again, that is not a
30 years later, I still have no path to citizenship. How long is this punishment supposed to go for? Because 30 years later, I still don't have a path to citizenship.
Reward is not the same as a punishment. That is not a punishment. It is the absence of a benefit or reward based on an illegal action that your parents took knowingly.
So I have to be in the absence of this reward of an action that I'm so grateful and thankful for, because I cannot thank my parents enough for their sacrifices so that I can one day become a lawyer and not only survive, but thrive. So I'm forever grateful for them. And if we could go back and do it again, we would do it all over again. But I don't think my punishment should be for over 30 years being in this country, employing U.S. citizens. I'm a business owner. I have my law firm. I pay more taxes than the president. And my punishment should be that I will forever never have any rights as a U.S. citizen. I will never get to decide who represents me in Congress. I will never be able to sit in a jury box, even though I'm a practicing attorney. It makes absolutely no sense.
So, if we send out the signal that if you come to the United States illegally and bring your children, we are going to reward your children by giving them citizenship, that is basically an invitation for more people to violate our immigration laws. Look, every single one of us as parents has to recognize that our actions have consequences on our children and other family members, and it's our responsibility. It is not society's responsibility. It's not the law's responsibility. It is our responsibility, and every parent has to recognize that.
Okay,
right. And so we should change the law so that more people are able to migrate without the silliness of waiting 30 years outside of the country in order to migrate, right? The waiting line right now for a citizen in Mexico is over 20 years.
Okay, this actually brings me to the question I want to wrap up with, which is, asylum seeking aside, what do each of you think our philosophical approach to immigration should be as a country? Ira, why don't you go first?
The philosophical approach ought to be that immigration is a public policy. It is there to serve public interests and public goods. We understand it is always in the interest of immigrants to immigrate. It was in the interest of Dulce's parents to immigrate. No question about that. The question is, what impact does it have on society? What impact does it have on everybody else? It does affect the lives of other people. It affects the schools that have to educate large numbers of kids who don't speak English. It affects people in the labor market. It affects people in every aspect of their life. So we do understand that immigration benefits immigrants. Nobody gets up in the morning and says, gee, I'm going to the United States to be worse off. The question is, what impact does it have on everybody else? And that's really what public policy is about.
All right, thank you. And Dulce, yourself.
Yeah, the American public benefits from migration, right? Whether it's unlawful, unauthorized, or lawful migration. And all the economic experts say that. Aside from our labor and the exploitation of migrant community, we contribute in so many ways to this country. And so a path to citizenship for the 11 million of us that are undocumented in this country should be a signal of America, right? We promote across the globe this idea of the American dream, but we don't live up to it. When we punish people, even after 30 years for breaking one civil migration code, it makes absolutely no sense that forever then we would have to put people in these cages because we can't travel, right? The border is essentially close to us that are undocumented. Yet Europeans are allowed to come in. Rich people are allowed to travel across the world freely and take advantage of tax evasion laws elsewhere, while we contribute to the economy by paying taxes. I pay into a social security system that I will never, ever be able to get one single dollar from.
Dulce, can I just ask you?
Pay, but not get anything in return.
Sorry, can I just ask you, so basically in terms of your philosophical approach, you don't think there should be a difference between those who are crossing illegally or legally? Once you come here, it should be treated the same. Is that fair?
I think philosophically, we have to make a statement of what America stands for. Are we going to stand for more death in our borders? Are we going to stand for the 11 million people undocumented in this country that we keep punishing for decades and still exploiting their labor? Are we going to still stand for meddling across the world without taking responsibility on this ridiculous war on drugs, on this wall that has caused so much pain, that does not address all of the issues and concerns that the American people have? So philosophically, we have to ask, are we going to be more humanitarian, or are we going to be this black and white stick by the law that makes absolutely no sense and that is stale and that was not even in place a few decades ago? We allowed Europeans to come here freely, except when it comes to Mexicans and Central Americans, then all of a sudden we have a problem with following the laws and making it even more difficult. You know, there's 5 million of us.
I think we're going to have to wrap up. We're out of time.
This is 1900, and we have to have laws in place that make sense for the country in 2020, not in 1920.
All right, we're going to. Sorry, both of you, we're out of time. We're going to have to wrap up. Thank you both so much for joining. Definitely a lively discussion. Thank you.
Thank you.
Coming up after the break, we look at the state of healthcare and where we're at with Obamacare. But first, here's America Q&A.
Yeah, I'm all in favor of like open borders. I mean, let everyone into the country, let anyone out the country. Like almost like the EU.
Well, the right one is to shut the borders down to all illegal immigration.
Separating children from their parents is not right.
So we have to make it more fair, much faster.
I firmly believe that we do need secure borders.
I would like to see the people who actually want to be here and working and paying taxes, to give them the opportunity to do so.
Well, I definitely don't think it's isolating kids from their families in cages, but I also believe that everything needs to be done the correct way as well.
Granting a path to citizenship to the both undocumented immigrants in the country, as well as expanding the visa program.
Those kids who was brought up here with illegal parents, once they are here for 18 or 19 years, they should be legalized.
Immigration lets some people in. There's people in here now, and the problem is they do work, but they don't pay taxes.
In 2010, President Obama passed the Affordable Care Act with the goal of making affordable health insurance available to more people. As we get ready to elect the next president, how have things gone since then? And what is the current state of America's complex healthcare system? We have two guests with us today to help unravel some of those mysteries. Seth Denson, he's a business and market analyst with a focus on healthcare, and he's also the chief strategist at GDP Advisors and the author of the book, The Cure, A Blueprint for Solving America's Healthcare Crisis. And Paul Seegert, managing partner at employee benefits consulting firm PCS Advisers. Paul, Seth, welcome both.
Thanks for having me.
So I'd like to jump right into it, and we often hear that our healthcare system is broken, and I'd like to hear from each of you, what does that mean? What are people talking about? Seth, why don't you go first?
Well, I think that to say it's broken is not to recognize that roughly 70% of all the innovation throughout the world comes out of the United States. So while it's quick to look at our healthcare system and say that it certainly has challenges that we need to address, what we don't need to do is disrupt the innovation that we have here in the United States. From a broken perspective, I oftentimes will refer to our healthcare system as a three-legged stool where the delivery system, the provider system, and the consumer need to try to work together, and unfortunately they don't. Really, it's more of a three-headed cannibalistic dragon, where the delivery system and the finance system, which is insurance, are working against the consumer. And so if there's an area that we need to address and really improve upon, it is that consumer aspect of healthcare.
Oh, very interesting. Okay, and Paul, what's your take on that?
I would agree with that. I'd go so far as to say that in the last 5 years, costs are up about 30%, and those costs typically get shifted to the consumer, the employees in many cases, and they have outpaced their increases in wages. So it's a huge problem for an average person.
Okay, so actually we're 10 years into the Affordable Care Act now, and some elements of it have been changed under the Trump administration. But looking back 10 years ago, can you tell me who are the winners and losers? Who has it benefited? Who hasn't it benefited? So Seth.
Yeah, I think there's certainly we need to address the fact that there are more people insured now as a result of the Affordable Care Act, whether that's through expansion of subsidies in the individual market or whether that's through the expansion of Medicaid, and that's certainly a positive. Secondarily, you do have protection against pre-existing conditions, something that both sides of the aisle have agreed needs to stay regardless of what happens with the ACA. So those are certainly the pros of the Affordable Care Act. The cons, as Paul alluded to just a moment ago, are that it did nothing to curb the actual cost of health care, that which we receive. And matter of fact, healthcare by and large has inflated at equal or greater pace than it ever has prior to the Affordable Care Act.
And Paul?
Well, certainly large health insurers have been winners. Their stock prices are up 2,000 and 3,000% since the inception of the ACA. And I think the big losers are the end users. And you can see that in the continually rising max out-of-pockets and deductibles that consumers are facing. If you don't have a top-tier plan in 2021, those costs are really insurmountable for most Americans. $7,000, $8,000 for an individual, when the majority of Americans, when polled, don't have $1,000 in savings.
Yeah, I wanted to ask about that because normally we talk about, the success of the ACA in terms of how many more people have insurance. But my question is, how much more money are Americans paying? There was this 2019 study from the American Public Journal of Health that found that 530,000 families a year declare bankruptcy because of medical bills. That just sounds enormous to me. So why are the costs so high? Why does healthcare cost so much in America? Seth.
Yeah, so there are two key provisions of the Affordable Care Act, I think, that many latched onto as these great key provisions, but were actually the most detrimental to the cost of healthcare. The first was the MLR mandate, and Paul alluded to this. The greatest winner in this entire system has been the health insurance industry, and they're the ones that cried foul the most when this thing was going through. But the reality is what happened is overnight they became finance companies, because under the MLR, or medical loss ratio mandate under the Affordable Care Act, it said that insurance companies were required to spend approximately 85 cents of every dollar they collected on claims. Now, if you're a publicly traded organization and you're now capped at a 15% margin, do you want 15% of a million or 15% of a billion? And so what we saw was this alignment where the healthcare system and the health insurance system combined. The thing that compounded that was the elimination of lifetime maximums. Again, one of those things that sounds great on talking points or Sunday morning talk shows, that we wouldn't have a cap to our health insurance benefits. But here's the reality. I was in the industry 10 years before the Affordable Care Act. In that 10 years, I saw 2 claims exceed $1 million. Both of those ended up in a life insurance claim. Today, it is not uncommon for us to regularly see multi-million-dollar claims day in and day out. Effectively, the Affordable Care Act gave a blank check to hospital systems.
Would you agree with that, Paul?
I would, and I'd say that we've trained the consumer to consume in terms of their deductibles, their copays, their share of cost, and we've insulated the consumer from real cost, total cost. And that lack of transparency has allowed many players in the supply chain, whether it's insurers or hospital systems or provider groups, to charge almost whatever they'd like. And that is a huge problem that is driving costs at an exponential rate.
So you talked about the transparency, and that's something both candidates, President Trump and former Vice President Joe Biden, have both talked about. So what will that actually mean? How will that benefit Americans if we have more price transparency? Paul, if you want to continue on that.
Yeah, I was talking to a head of a hospital association for one of the states where we do business, and they are in favor of transparency, at least the association, but they have more than 150 different prices for one procedure.
Why?
Because of all the various contracts and negotiations that they do with the different insurers and payers. And in fact, it's so extreme, you could go get a total knee replacement at a center of excellence. One of the very best surgeons in the country could provide this service for you and pay $19,000 for that. And yet we see them at $140,000, $270,000, $80,000. It's and all of that is going on behind the scenes, and the consumer's completely unaware of that. And then when it comes time for renewal and they see how their premium is going up yet again, and likely there's cost shifting in terms of payroll deductions to them, that's the cause. We need transparency more than anything if we're going to fix healthcare.
Do you agree too with that, Seth? Is that the #1 priority?
Yeah, absolutely. I couldn't agree more. If we look at our U.S. our U.S. economic system in its entirety, the greatest regulator of our economic system is the American consumer. And that's because we live in a free market. However, when it comes to health insurance and healthcare in general, it's not a free market. We might think it is, but in a free market, information is free. And healthcare is the one aspect of our economy, a sixth of our U.S. economy, where I can go and get something done and not know, to Paul's point, exactly what I was really billed because I just know what my deductible is. And I likely don't even know that until 3 to 6 months later. And as a result, our industry, the healthcare industry, has trained consumers not to look, not to try to find things. And health insurance networks have created a veil where it's almost impossible to determine what your costs are. And as a result, today in the United States, the average American consumer will spend 10 hours researching a car before making a purchase, 2 hours on a flat screen TV, and 15 minutes on healthcare related issues.
So how did it get to this point? How is it that the insurance companies are able to drive all this kind of craziness that's driving the prices up and making it impossible to find better alternatives? Paul, how did we get here?
Well, I always go back to transparency. In many states around the country, you can be an employer who has fiduciary responsibility to manage a health plan, under ERISA and yet not be able to get a P&L on the plan. It would seem to me that it would be pretty reasonable that that plan sponsor would be able to know where every dollar in that plan went and what procedures cost. Yet when they're faced with a renewal, oftentimes the data that they have access to is very limited. So we need transparency rules that require it. They do exist in some places like Seth's state, but in most states they do not. For the majority of employers, they don't get access to that information.
So do both candidates have a plan to do something about this, Seth? Like an actual plan?
It's interesting because, Joe Biden has presented some aspects of a plan, which is really to expand upon the Affordable Care Act, which means, and let's understand, the Affordable Care Act primarily focused on the insurance industry. There's very little about the actual cost of healthcare. And when you do that, it's just like squeezing a balloon. You're not taking any air out of it. You're just moving it around a little bit. And so the Biden camp has pressed that we need to expand on the Affordable Care Act, which, as we've already discussed, has only increased the cost of that which is delivered. The Trump administration, while they have done some things throughout their 3.5 years around pricing transparency and trying to require that and lowering the cost of prescription drugs through importation, they haven't done so around a plan. And many of us, and I believe Paul's included in this list, have been calling out for a long time for the president to release a plan, to tell us, hey, here's exactly what I'll do over the next 4 years, knowing that Nancy Pelosi would never let it see the light of day until after the election. But we certainly need to see where the president wants to take us over the next 4 years to expand on those things he's already trying to do through executive order.
Let's talk about the case before the Supreme Court right now. Everyone seems to say it's about pre-existing conditions. They won't be covered. They will be covered, if this goes through or not. That doesn't seem to be what the matter is before the court. Can you explain to us, I guess, Paul, you start with that. Can you explain to us what is before the court and what's at stake?
Well, does the law stand without the individual mandate? The law was allowed to go through in part because they deemed that the tax, it was a tax if you didn't have health insurance. You weren't being required to purchase health insurance. So when that individual mandate, when that fee was gutted, then the whole law came into question. And so now that's gotten up to Supreme Court, and there's a severability issue there. If that part of the law is no longer valid, is the entire law valid? I think a lot of folks in the political circles, some of the talking points today are indicating that would affect pre-existing conditions, and it's simply not the case. It has nothing to do with pre-existing conditions, and it would be political suicide for either side to do anything to endanger pre-existing conditions. There are parts of the ACA that, aside from cost, are popular with all Americans, and coverage of pre-existing conditions is one of those. So it's, I would say, in a very safe position.
So which way would you like to see this ruled? Paul?
Well, I think the negatives outweigh the positives with the law overall, and the parts that are being used to preserve the law are not really in question. Pre-existing conditions are not an issue today. I don't think they'd be an issue if it were to be done away with. So the negatives in terms of cost and the pace of increased cost, I think outweigh the benefits.
And Seth, do you agree with all that?
Yeah, I do. I mean, I've never been a fan of the Affordable Care Act. I understand the premise by which something needed to be done. We had been in a 20 to almost 30-year cycle of massive inflation, 2, 3, sometimes 4 and 5 times that of the CPI. So we needed to address the issue. The Affordable Care Act, as I've mentioned before, though, didn't address the issue in its entirety. It addressed health insurance only. So I'm probably more of a fan of let's repair the Affordable Care Act. And here's why. Compromise is never found in D.C. anymore. And we can't see the pendulum swing from one side to the other as vastly as it did when the Affordable Care Act was passed in the 10 years since, when the Republicans tried to replace it. They're never going to get Democrats on board with anything that isn't called the Affordable Care Act. So I don't care what's in the name. Call it what it is. Keep those pieces that Paul already mentioned are good and are popular with America, things like elimination of pre-existing conditions, and kids can stay on their parents' insurance till age 26, those types of things. But let's repair it. If Republicans would take that approach, I think they might get some Democrats on board to doing something, and then we could start to address the real issue, which is the inflating cost of health care, that which we receive.
All right, well, we're just about out of time, so I want to give you each a chance. Anything else that we should know about coming into the election? Anything we should know about the two candidates' positions and what that'll mean for the future of healthcare in the U.S.? Paul?
Well, I think Seth's already pointed out the fact that the Biden plan, as far as we know, is to continue to expand access to health insurance or coverage and does not address cost, which is a huge problem. It's on the mind of most Americans. More than anything, there are shining examples around the country where employer groups are accessing care at half the price of the country as a whole. And we need to learn from those examples and fix this problem, which is a cost problem, not an insurance problem. It's the cost of care. We're paying $10 for something that should cost $5. And I don't think we have much chance of seeing improvements in that area with a Biden win. And so I would have to say healthcare's future is likely better if it goes the other direction.
And Seth, anything to add there?
You know, I think as Americans, what we need to understand is that our free market system, at least from a consumer-driven and even an innovative private sector system, needs to remain intact. The rest of the world, or many parts of the world, can say that their socialistic medicine system works, but it does because we don't have it here. We innovate here in the United States. We develop. We create. And if we go into any type of system where the government is in the business of running healthcare, that innovation stops immediately. So regardless of which direction we want to go, consumers and voters need to keep in mind that we must continue with a free market system. We must allow the private sector to continue to be part of the delivery system and the innovative system that we have.
All right. Thank you both for joining us today.
Thank you very much.
Coming up after the break, we go on the road with Epoch Times host Roman Belmakov to the battleground state of Arizona. But first, here's America Q&A.
I mean, it's really unfortunate that a lot of people have to pay certain fees out of pocket. I went to the gynecologist like literally a month ago, and I had to pay close to $400 to receive an ultrasound, and I couldn't afford it. So I literally walked out. I couldn't pay for it, so I just left. And I'm hoping now, fingers crossed, that I'm okay.
Well, my experience has been good since my family, we're all like under health insurance, so like getting doctor's visits and stuff like that hasn't been necessarily hard, but I do know like a couple of friends of mine that don't really have insurance, and they always talk about like how costs are high and hospital bills and stuff like that. So I think there definitely needs to be some fixing to do there, like a universal healthcare system. I feel like that would work best.
I'm on the opposite side there. My family doesn't really have that much health insurance, so usually we just try to not get hurt, hope for the best.
So you're trying not to get hurt?
Yeah, pretty much, because if anything happens, then...
I don't have any complaints because I'm on like a housing voucher, so I get Medicaid, you know, with Obamacare. I don't pay for anything, but I know like my mother didn't have it. She's 67 years old and has to work at McDonald's just to try to... That's the only reason she works there. She should be retired, but she's got to have something.
I feel lucky to have a job and have health care, but I want to live in a country where health care is not a privilege, it's a basic right for all.
My personal experience is healthcare for me is really good. I never had an issue with that.
My wife works in the city. She has a great health plan. We have Tufts. It works well. I don't want to give it up. It works for me. But, you know, I mean, the healthcare system now, you know, it's getting a little crazy. It's expensive. I mean, let's not kid ourselves. I mean, a buddy of mine, you know, owns a company, and, you know, he's affected by the corona, and his business is, you know, he owns a limousine service that takes people back and forth to the airports, and he's not doing that right now. You know, his insurance is $1,900 a month. I mean, that's a lot of cash. That's $500 a week before you even do anything, just to pay for health care. And above and beyond all that, I think he still has a $4,000 or $5,000 deductible.
So my grandma actually has Medicare and Medicaid. So I've seen firsthand my mom trying to go through it with what services she's offered under which health care plan. And frequently there's times where she's not offered a certain service, like physical therapy, she's only offered like twice or something, and then she needs it more, or else she gets pretty stiff and is stuck in bed.
Well, I'm okay because this country takes care, basically, I'm a veteran, So I'm okay. So they take care of us, regardless of, it may not be the greatest or the fastest, but they do take care of us. So my stand.
With the 2020 election right around the corner, we came here to the swing state of beautiful mountainous Arizona in order to speak to the people and get an idea for which way the political winds are blowing. Arizona is a fascinating place. It is the 6th largest state in the nation. It is the only place on Earth where the iconic saguaro cactus grows, and it is the only American state that does not have daylight savings time. Now, traditionally, Arizona has been a Republican stronghold. The state has voted for GOP presidential candidates since 1952, with only one exception, Bill Clinton's 1996 re-election bid against Bob Dole. However, the state has been inching more and more left in recent years, as indicated both by polling and the narrower margins enjoyed by Republican candidates. In 2016, Trump won the state with 48.1% of the vote, the narrowest GOP margin in recent history. And so we went to downtown Phoenix to ask around and see why that is. Unfortunately, when we got here to downtown Phoenix, both on weekdays and weekends, it's a veritable ghost town. Very few people are around, and you can walk down an entire avenue and see almost nobody. Businesses have been suffering here like everywhere else in the country, and the lockdown is not the only factor.
Our sales not even cover our bills, not to mention our food costs and employees. I'm just talking about electric bills. My name is Rachel Macaulay. I own Thai restaurant called Zen Thai Cafe in downtown Phoenix. We didn't get hit only for COVID. The Central Street is where everyone doing protesting. They have to sleep here because otherwise people will, I worry, people will ruin the restaurant.
These protests are part of the larger BLM and anti-police protests that erupted across the country after the death of George Floyd. In Phoenix, sporadic protests still continue. Luckily, we found the Gideon Farmers Market, a place where hundreds of people come to on Saturdays to chat, play with their kids, and buy local products and produce. And we got a chance to ask them what they're thinking about ahead of the election. What would you say maybe your top 1, 2, and 3 criteria are as you're deciding between candidates?
I would say personal liberties is probably my top one.
I would say the first would have to be a balance in government. I think we need a smaller government, honestly.
Environment, for sure. Healthcare. I have women's rights is really important to me. So I would say those are like top 3 right now, especially the pandemic also, the handling of it.
And of course, Social Security, want to protect it because of my age group. So we're pro-life, and I would like to be able to, I wish there was such a thing that we could have some of the poor taken care of without making it so political that it would be an issue that wouldn't be so difficult.
My number 1 would probably be science, also equality. I am not a big fan of right now all the misogyny, all the fascism and racism going on. And then overall, just anything anti-Trump.
Healthcare for everyone is probably one of my first priorities. I think healthcare is a right, and we should find a way to make sure that it's a right that we have afforded to all of our citizens of all statuses and wealth.
Yo estoy decidida por Trump. Creo que la economía es muy importante y tiene un gran liderazgo.
Arizona is one of 4 U.S. states that borders Mexico, and Phoenix is about a 2 or 3 hour drive to the border. Given how much emphasis candidate Trump placed on border security and immigration during his 2016 campaign, we thought that this would be a hot issue here in Arizona. To the left of me here, you will see part of the 300 miles of new wall built along the U.S.-Mexico border, a physical embodiment of the Trump administration's border policy.
What has happened with lax security at the border is that the cartels are now infiltrating America. Other gangs from Latin America are infiltrating America. International terrorist organizations are now infiltrating America. And quite honestly, that's been within the last 5, 6, 7 years. And I believe that it poses a tremendous danger to America. Hi, I'm Richard Mack, mostly known as Sheriff Mack. I'm the former sheriff of Graham County, Arizona. I'm probably one of few public officials and law enforcement officials in the entire country who has walked the drug tunnels of Nogales and Agua Prieta, and also ridden with Border Patrol agents the machine gun boats along the Rio Grande near McAllen, Texas.
Do you see any change over the last 4 years of the Trump administration, their policies on the border?
Well, certainly the border has become a lot more secure under President Trump. I support the wall, but it's not a catch-all. It's not going to solve everything.
What really surprised me, though, was how few of the people that we spoke with on the street mentioned either the border or immigration as being among their top 3 main concerns during this election cycle. But I just wonder, why do the people themselves who live here not view the border as a big problem?
Well, you know, maybe it hasn't landed in their front yard yet. I don't know. You know, and a lot of people look at it in a humanitarian sense. If these people are just trying to make a better life for themselves, well, of course, let them in. I say the same thing. Let them in, legally.
Both parties see Arizona as a key battleground state, evidenced by the fact that Phoenix and Tucson are the #1 and #2 cities in terms of the Biden campaign's advertising spend. The polls indicate a neck-and-neck race for Arizona's 11 electoral votes up for grabs. So which way do people who are actually living here think this election will go? What's your opinion living here on the ground? Which way do you think the wind is blowing?
No clue. I wish I knew. We talk about it every night at dinner. We talk about it with our friends. No clue.
It's going to be close. You know, I wouldn't want to put any money on it. If I was a betting person, I wouldn't feel safe putting it either way.
I don't know. It's hard to tell. Last election, you know, we thought Arizona was definitely Trump all the way, but it's hard to tell. I do think it's leaning a little left. I'm not sure. I've been watching the polls, but I've seen it that way. So we'll see. We'll see what happens.
I think it's swinging towards Trump because when he first came through here 4 years ago, he shut down the city pretty much, and he had a big rally. And same thing when he came I think it was about 4 or 5 months ago.
I'm hopeful for Biden, but I'm not really sure. It seems really split right now, even around the ASU campus, of which way things are leaning.
Well, right now I think they're going a little bit Democrat more than they are Republican this year.
I think people want Trump another 4 years, to be honest with you.
I think it's going to go probably right wing for sure. Yeah.
I think it's going to be a blue state this year. I really do. I think we've had so many protests, and are you okay?
Yeah. I don't think it.
No,
I don't think it'll happen. No, I don't think.
You were biting your tongue.
Yes. I don't think so. I think it's. I work in the service industry and I talk to a lot of people, you know, homeowners, and the conservatives are still super strong out here.
Just like this couple, at this point, I don't feel any closer to knowing which way Arizona will go.